Hello, everyone, and thank you for joining us today for our live session. We're very happy to have you here. Windwire, in partnership with Microsoft, welcomes you to the Evolving Vaccine Management Solution panel discussion, where we are honored to have expert industry leaders discuss best practices and current trends in vaccine management, such as distribution, supply chain, registration, and more. You will also learn about how Windwire's expert enterprise vaccine management solution is helping healthcare organizations and communities coordinate a safe and efficient vaccine program securely and accurately. I'm Bianca Beatty, your moderator for today's panel. Today's discussion will run until approximately 10:50, and at that time, we'll open the floor for our live Q&A session. Okay, without further ado, I'm happy to introduce you to our panelists, Dr. Clifford Goldsmith, the U.S. Chief Medical Officer at Microsoft, Ashu Goel, the CEO at Windwire, and Varu Pax Marai, the Vice President of Technology Solutions at Windwire. Welcome, Dr. Goldsmith, Ashu, and Varu.
Thanks, Bianca.
Great. I'm going to start off with an opening question to all the panelists. How are the state of affairs currently as it pertains to vaccine delivery and administration during COVID-19 2021?
So I think what I'm hearing, Bianca, you're asking is really what's the current state of affairs as it relates to vaccine distribution. And I think, as we were just talking prior to the session getting started, I think we are seeing that there's still a lot of challenges right now in the supply chain. I think planning and running that process is still causing a lot of issues. Even though I think in US, if you take a look at it, we are relatively doing well with 2.5 million, plus doses being administered daily. But globally, if you take a look at it, there are still a lot of supply chain issues from what we are seeing right now. Dr. Goldsmith, if you want to add on to it.
Yeah, I think you're making a really good point, Ashu, that this is a global pandemic, and we're not going to solve this if we don't solve it everywhere in the world. And so we need to make sure that there's a strong supply chain. And some countries haven't even started the vaccination process yet. And so I think it's really important for us to enable that supply chain. And we're probably going to talk a bit about this, but I'm very excited to see, for one example, that Merck and J&J are collaborating. That's the kind of example that we need in order to do this. I mean, we're all in this together, and it's going to be a very different strategy to business in the past. The other very positive thing, at least in the United States, is starting to look at the supply chain at the federal level, at an overall level. And I think that's true for other countries like Europe, not just a country, but Europe as an area needs to do that as well in order to look at supply chain at a higher level. And so I agree with you. I think predictions are, unfortunately, that April is going to be an adjustment month with lower supplies until we get this absolutely right. So I agree with you.
I would agree. And I think you touched upon a very important point, Dr. Goldsmith. The cross enterprise collaboration that we are seeing, I think is fantastic. You talked about Merck J&J. We are seeing the same scenario in terms of vaccine production. In different places, folks are not just looking at producing their own vaccines, but they're reaching out to others as well. So yeah, I completely agree. I think that's going to be a big help.
I wonder if anybody else has any other thoughts on this that would like to comment. Varu or anybody else?
Varu?
Yeah, I believe, a lot of collaboration is needed. As you rightly said, it's truly when we collaborate together and partner on the supply chain, we can solve this kind of a massive problem. And it's not just local in small counties or cities, it's like all over the place. And, people are starting to get frustrated with the wait times or the delay times and the queues. And that's what we want to address today in some of our discussions.
So maybe I should, if it's all right with everybody else, I should get started and get my short presentation going and do a bit of an introduction. So
that would be wonderful.
That would be great. So I trust you can see my slide, my introductory slide. I'm Clifford Goldsmith. I'm as Bianca said, I'm the US Chief Medical Officer for Microsoft. I've been deeply involved in this entire process I've been at Microsoft 21 years, and in the last year, I've spent almost the entire time working on issues related to the pandemic. When I think about the pandemic and especially where we are today, I'll come to some of the thoughts I have about where we've been and where the future is. But we are looking at the pandemic at this moment at Microsoft in these four categories, and they contribute to each other in a spiral, in a sense. They're a process that will go on and on. So where we are, if we start at number one, we could start anywhere in the circle. We are very deeply involved in thinking about enhanced surveillance and testing. And what we mean by testing there is disease testing. And in this space, one of the areas that we've made significant inroads in the last year, and I think this is true of the pandemic in general, that it's made inroads into data and AI. This is really the tool behind this, that if we apply AI correctly into the surveillance model at the right levels, we'll be able to pick up on where disease is prevalent. And I often look at results, even this morning, I look at results every day of how we're vaccinating and how we're doing. And you said that, Sure, a moment ago, in the United States, we're doing quite well. I think we're the fourth most vaccinated country based on our population. There are other countries like the UK are doing very well. Israel is doing well. But really the important point is where are those vaccinations going? Because if we're going to control this, we've got to control it at the global level, and we've got to control it at the regional and country levels as well. And to do that, we've got to have insight into probably more like zip code level in the US or county level data in order to understand which counties are being vaccinated and what the rates are in those counties, because otherwise we'll continue to have these pockets of unvaccinated populations with fairly widespread disease. And one of the problems with widespread disease is that you get more mutations and you get more variants. And so getting this under control from a surveillance and testing point of view is very important, especially in countries where, like the US, where there's far less government regulation. We need the tools to do that. And so that's why what you're going to hear today from Winwire in terms of vaccine management is so important. Other things in the surveillance area, we do a lot of work around genomics, and we have Microsoft Genomics. Part of that genomics is looking at the human genomes, as well as looking at looking for genomic patterns in vectors like mosquitoes for surveillance in general. Then this is talking about in general, in not COVID specifically, but for COVID, it's going to be doing sequencing on the COVID vaccine as we diagnose it, in order to pick up on variants and make sure we start attacking those variants. And that plays very nicely from number one into the second part of this, which is how do we accelerate R&D? Well, we've seen remarkable work done by pharmaceutical companies, especially bringing to market new vaccines like messenger RNA vaccines. And that has been, I think, one of the stories that will be told in years to come will be the feat that was taken, the feat of the pharmaceutical companies to bring these vaccines to market so readily. I don't believe we've cut corners on that. I think we've expedited the process. But where we are now is, as these variants pop up, like we've seen the South African variant and the Brazil variant, the UK variant, and actually, I'm sorry to call them by their names because it has nothing to do with those countries at all. But those variants are beginning to spread, and we need to know where they are, and we may even need in the future to build boosters. Fortunately, right now, most of the variants are being controlled by the vaccine still. But as more variants pop up, we may need boosters, just like we have done in the past with the flu vaccines. We also are working on scaling up manufacturing, and we talked a little bit a moment ago about the collaboration between different pharmaceutical companies to improve manufacturing. I also think there's lots of potential, and we're very excited about some of the new developments where we're engaging deeply with a company here in the United States, which actually grew out of England, a company called Apiject. It's an injector that is preloaded with vaccinations, and that should be on the market in the next 6 months or so. Big factories being formed, and we put up a gigafactory, and they are planning to distribute. That is going to improve distribution as well as enhance the manufacturing process as well. Will mean that pharmaceutical companies merely need to make the vaccine in bulk and then distribute it through this mechanism. The third part, which is going to be the major focus, I think, of this discussion, is going to be around vaccination and the management and administration of vaccinations. It is so clear to us, I mean, that there's been an inequitable distribution of this disease, and there's a totally inequitable distribution right now of vaccinations as well. And without putting in place the right kinds of process, we're shooting ourselves in the foot, in a sense, because the people who most need it need to get that vaccination first, whether it's the elderly or the seniors, whether it's people with comorbid diseases. But when we use mechanisms, as are happening in some places, especially in the United States, that allow, that lead to wastage and lead to people desperately trying to get anyone vaccinated, it's very likely that the people who have most access are going to get vaccinated, which in the long run is not going to really support the whole process. And then the last part of this, or the last part of the cycle before we cycle back, is how do we enable this new normal? And I really mean the word new normal, because I don't believe it's back to normal. I mean, we are not going back to where we were pre-pandemic. And one simple example here at Microsoft is that we have already committed to a hybrid work environment for permanently for the future. And while that's is easy for someone like Microsoft, because we've been doing that for many years, it is a clear statement that we recognize that what's going to be happening in the future is going to be very different. So if I can go to the next slide, I'll try and make this quick. The way we look at this, we're looking at this journey through the pandemic, and it hasn't finished. We don't know where this is going to end, but it started with emergency responses. A lot of work went into things like chatbots that we enabled and others enabled, and actually WinWire was part of that process with us as well, where we made chatbots available for understanding whether you have disease, whether you need testing. We made chatbots available for tracking and tracing as well. And now we are making chatbots available for vaccination, for people trying to find vaccinations as well, along with other systems that are out there. The other thing that happened for everyone is this move to virtual health, and I'm sure we'll talk more about it. As we move as this process moves forward, the journey moves forward, we are now probably in this area down here where vaccine management is key. And we're beginning to look very carefully, and I think that will be, the next 3 months or so, we'll be talking about getting people back. Well, back to school looks like a given in the next month, for certainly for K through 12, we're hoping, and then back to the office will start to happen, maybe in a hybrid setting like we're doing at Microsoft. Disease surveillance will continue, genomics will need to continue. Fraud and abuse is going to be a huge problem going forward, and we're beginning to look at that already. And then moving into a new world where we will continue in smarter cities.
This series of asset classes can all.
So here's a look at where we are with today with some of the things that we already have. There were vaccine management systems in place, and I'm simply putting this out there so that you can look at the WinWire solution that you're about to see from that perspective. Those were inadequate and were shown to be inadequate. So new capabilities were needed in the center. You can see those capabilities. Those are enabled by WinWire and other partners of ours. And they run this on our broader technology platform, which we call the Microsoft Cloud for Healthcare. I'm not going to spend a lot of time on this because I'm sure we're going to have some discussions about it. But here are the many touch points that we think about and that you're going to hear from WinWire about around the data that platform that prioritize and vaccination and manage the supply chain. And I just wanted to, we talked a bit about this already, very exciting to see this kind of collaboration. This is what's going to be needed as we move forward. I'm excited about this collaboration as well in that fourth area of getting us back to the new normal or into the new normal kinds of tools. And I know that Mickey Tripathi said he doesn't like the word passport because it's a government issued item. and he's probably right. But I think what we should call this is as he did, credentialing. Mickey is the new ONC lead, and is very, starting to put a very good agenda together, which I'm excited about. But many of us that are in the technology companies and many of our partners are looking at this possibility, rather than carrying a piece of paper around in the United States, having a credentialing vaccine application that we can then show, especially as we need to travel again, and there are likely to be requirements for this. Other countries actually, in some cases, are further advanced compared to the United States. Certainly know my family in Australia have an app on their phones that they can show whether they've been tested, and will be able to show when they have been vaccinated. I just wanted to again highlight a few of these things. I've already mentioned most of them, but virtual health is a huge driver at the moment, and I think is here to stay. But we have to do work. We've got work to do about how to make sure that virtual visits, which were a necessity in the pandemic, really become virtual health, which to me means having all of that data that you used to have, or as much as you can that you had in a face-to-face visit, available to you. Remote assist has become a key part of the medical device world, as well as the provider world, so that people that are helping surgeons, for example, as they insert or implant new devices, companies obviously help them enormously to do that. Those now are being done remotely. And so that's a whole new area of development. And then this virtual clinical trials or decentralized clinical trials are likely to be a very important part of the process as well. So I think I'll stop there in the interest of time and hand back to you, Bianca, because I know you wanted to move into a Q&A. So thank you, everybody, for your time.
Very insightful, Dr. Goldsmith, and very appropriate. We are certainly seeing. It was very interesting. You walked us through the pandemic journey, the life cycle, and the map. I think I agree. We are in the early stages, and I think most people are thinking this is towards the end. I think it's going to have a huge impact in getting back to a new normal. So very, very well articulated, I thought. Absolutely.
Thanks.
Absolutely. Ashu, when do you feel life will return to normal for people in the U.S.?
Good question, Bianca. I'm sure we are all anxious to figure out, and I wish we had a crystal ball to figure that out. But I think, as we were talking earlier, if you really take a look at the rate of vaccination where we are as a country, in US, 2.5 million vaccinations per day, increasing up to 3 million. We're already vaccinated 25% of our population. Certainly the most sort of urgent vaccinations have already happened. The way I see it, with the latest announcement that by May 1st it will be available to most people, I think if we take precaution now and don't let our guards down, so that we don't let it spike again in US and end up into another set of variants, as Dr. Goldsmith was talking about. I think by July, August, we can start to get back into the new semblance of, small groups meeting. We are certainly hoping and shooting for that. I think the biggest unknown is the spike in cases that we are seeing around the world right now, and the new variants that can spawn into. And that's really the core of what we look at. So we are certainly hoping by summer, certainly by late summer, we should be looking at it. But the core message from my perspective would be is not to let the guard down now. I think we are in the final stretch, hopefully, and we can make it a final stretch if we take precaution now. I'm sure, Dr. Goldsmith, you would, if you want to add on to it.
No, I agree with you. Although I still am, I think we're in a paradigm shift as well. So it's a new normal, as you said, not a normal. It's stability in many ways. When will we be stable and be able to? And that, to me, is what we're looking for. Is a time of stability. And we've gone through, obviously, incredible turmoil in the world. And this is not the first time, but it's the first time in my life that I've been through something like this. And I think, obviously things like, the pandemic of 1917 was 17, 18 was similar. World War II and World War I were probably very similar. But this is a monumental moment And I think that we don't quite know what that change is yet. And I don't want to spend the time on this call discussing it. It's beyond the scope of this call, but it's a very important discussion to think about what stability will look like.
I think a very good point. And I think, Dr. Goldsmith, as you said, I think it's an important area. A lot of people are very anxious about hearing more about it. I think maybe it's worth for us to come back at some point and talk about that. But you're right. Right now we can stay focused on where we are. But that's an important area that I think everybody would love to hear some of your thoughts and analysis and synthesis of what you're seeing out there as well. Yeah, agree.
I'll give you one good example of what I think is going to be part of that stability. Yeah, I've been writing a blog, which I'm hoping is going to get published for Doctors' Day on March 30th. And the piece I was writing about is physician burnout or clinician burnout. Prior to the pandemic, I must have spent the last 15 years of my life thinking about why do clinicians feel burnt out? And we blamed all the technology for it, and we thought that they were now being asked to work in a way that they didn't want to work before. That changed during the pandemic. They felt less alienated from their work. And the question becomes, how do we keep that in this new stable environment so that so clinicians, nurses and doctors feel as invigorated as they feel now, even though they work so hard and have been so important to all of us, but they still feel they feel loved and adored, as we've seen around the world. And how do we keep that in place as part of this new normal?
I think that's a very important point. And Dr. Goldsmith, I would expand that out to not just the clinicians, but I would say frontline workers and teachers and anybody in the front line. I think we have truly realized the importance and of what they do, and how much they need to be appreciated for what they do. It's amazing. I still remember in early March, we were thinking, we're not going to get groceries. We're not going to be able to get any supplies. And all these guys at the front line kept it going. They were the miracle workers at that time to keep it going. So yeah, I agree. I think that it's going to be very interesting on the new normal side. I'll let Bianca let you get back. Otherwise, we'll end up talking on this. It's very
absolutely. And just a reminder to all of our guests, we are going to have a live Q&A at the end. So please use the chat box to type in any questions you may have, and we'll address those at the end. Thank you. Okay, this question is for Dr. Clifford. What are your thoughts around senior citizen vaccinations and the challenges facing those issues?
So I think, to me, when I think of senior citizens, I think they are one of the examples of the inequity of the system that we're seeing, and it's portrayed. And a lot of this is from personal experience of hearing my friends taking care of their mothers and fathers, and I think that I do think that people that are not living in long-term care facilities or extended living facilities where there are people taking care of them, if they don't have a family member that is able to work on their behalf to get them vaccinated, to give them support, to help them not feel isolated, it's a very, very different situation. And so I think when you talk about senior citizens, I think you have to separate that up. Where baby boomer kids have parents and are looking after them, they're making sure that they're registered for vaccinations. They're driving them hundreds of miles sometimes to get them vaccinated. I've heard many stories of 100-mile drives to get to the first vaccination. But think about the people who don't have that kind of access, people who don't have easy internet access, computer access, are not as aware as they could be and many of the senior people seniors are not aware of when they can be vaccinated, how they can be vaccinated. To me, the biggest problem that we haven't seen yet is this hidden tip of the iceberg. We're seeing the tip of the iceberg that says, oh, they're all getting vaccinated. We haven't yet seen that rest of that iceberg below the surface that are not getting vaccinated. And so to me, it's imperative for us if we're going to save lives of senior people, but we're also going to save our own lives, because that's part of how we're going to stop this pandemic, is that we get to a situation where we reach out, where we have people going into homes of senior people, of seniors, where we have reach out elements into the senior community. And so that's what I think about. Ashu, I don't know what you think about when we talk about, think about seniors and the vaccination process.
Yeah, no, I think you covered, Dr. Goldsmith, all the points. I clearly, I agree with actually most of the points that you're making. I think we are not realizing what we are missing, and I think soon we'll need to address that as well as we move forward. And certainly having more doses available is helping. I think more drives are helping. As you said earlier, I think more federally coordination that we have now in place is helping. And so certainly, we see that as we move forward.
Yeah, I'll add one more story, just a small story from across the seas here. We are sitting in the US, and maybe some of our parents are abroad in other countries. And, education is so important, awareness is so important. The initial wave when the vaccines came out, I heard from a lot of the senior citizen community that, hey, there are too many side effects. I don't want to do this. I don't want to be the guinea pig going first. But that awareness and sharing of information is so critical. I saw people, and I also did the same, sharing photographs of that selfie, right? That you've just been vaccinated, everything is good, the side effects are not there for the first day or two, and then people start accepting that. So even my mom went after a lot of discussion around this topic as to when to go, what is the right time to go. So I agree with you, Ashu and Dr. Clifford, that there's a little bit of awareness and education needed, because I believe at least 30% of the population are waiting or holding back because they're not sure, is Johnson & Johnson effective? Is this more better? Or what path is the right path for them, if that makes sense?
That's a very good point. I've certainly heard from seniors that are worried about the effectiveness of, and while I believe that the Johnson & Johnson vaccine is an effective vaccine, there's no question about it, its rates are certainly lower than both of the messenger RNA vaccines from Pfizer and Moderna. But it is, but I do hear seniors concerned about wanting to get the best vaccine, and worried where in countries, especially where there's, they only have the J&J vaccine, worried about whether it is as effective. We need data. We need to show that. I believe it is. I mean, this is not in any way a knock on it, but I do think there's education around that as well. So that's
completely agree. Bianca, I know we are at 10:30. I want to make sure we have time for Viru and
yes,
and then Q&A. I'm sure there are a lot more questions people are anxiously waiting to hear.
Yeah, Viru, I have a question for you. Given the anticipated scale and speed of the vaccine and delivery process, how can AI-driven technologies enable support for planning, delivery, monitoring, and management of vaccination programs and ensure a safer return to work atmosphere?
Yeah, the key here is, meeting people's expectations. Everybody is expecting something, and the experience that we deliver to them, that has to be, catered in such a way that we can handle these kind of needs. So when you talk about AI or any such technologies, right, which enable us or reduce that friction in the process, it's very critical to, match the demand to the supply, or even the other way, because, it's not that easy. You're never going to match exactly supply and demand, all the vaccines coming and people expecting it. So my focus, at least, this is a good segue. If you don't mind, I'll take you into the solution, where our solution at Winwire is focused on the tracking, the inventory you have, as well as making sure people are, scheduled for receiving that vaccine. So let me just switch over, if you don't mind, and show you a little bit about our solution. I'm going to, yep. I hope you can see my screen.
Yes, we can.
Okay, great. So I'll put it in presentation mode, and you'll see, just as a quick, precursor, as you already stated, there are 334 million doses that have been administered, across so many countries. But where is the gap? I mean, unless we achieve some kind of herd immunity, which is, you can see from this chart from McKinsey and company, that it's at least 3 to 4 times of what we did for H1N1 or flu shots. We are not going to achieve that herd immunity, and therefore it's important to recognize that even though a lot of vaccines are being delivered in all these states and counties, what's the gap? What is the kind of the huge gap that we need to address in terms of making sure these vaccinations are happening? And obviously, the more important thing is, if we don't have enough appointments, if people are not really available there, right, at the right time, right place, if they're missing their schedules, then what happens, right? We waste a lot of vaccine. So it's kind of a balancing game, balancing act per se. And I'd like to quickly show you that, when we look at the whole supply chain and the kinds of problems which are there around the block here, whether it is from the clinical trial and the vaccine development, the early cycles, or whether we are here in the delivery and distribution side of things, it's important to look at the last mile of delivery. So these challenges are being addressed by the solution that I'm showing you today, in terms of self-service, in terms of registration, in terms of return to work and safety when you're returning back to work. And also, we have been doing this a lot now. More and more control and administration is needed, insights to be derived from that. At Winwire, we have a bunch of solutions, and they're all coming together in a nice way. As Dr. Clifford said, we have been working closely with Microsoft on telehealth, and all of this comes and plugs and plays like Lego blocks. So we are going to show you an example of return to work along with vaccine management, and how what we have been doing for the last 4 or 5 months is now starting to create a better experience for people. So the return to work experience, if you think about it, it can be simple. It's just a mobile pass, or collecting insight about what you need to progress and come back to work. But at the same time, this experience can be modified and connected to vaccination as well. And so I'm going to show you kind of the vaccine management approach to this, which is having a web interface or a mobile interface, also attending to planning and education and awareness, and also looking at the administration part, managing the queues, because we are hearing a lot from some of our customers and even prospects that they are stuck there. Too many queued up, too many people waiting in line, too many missing the appointment. So keeping that in mind, this is kind of the overall architecture or solution. On the left side, you see provider systems, right side are the users, and in between you see these experiences that we're going to show. And all this is using Microsoft Cloud for Health and bots and technology that you see. Even Dynamics 365 is in there. So I'll show you these two personas, one for a citizen or employee and the other one for an administrator. And when you look at this, right, simplicity is key. How we manage the experience, how do we deliver that experience? And this is what we are good at Winwire. We design the experience in a simple and elegant way so that more of these can be administered successfully. So if you think about the journey itself, the patient journey or the guest journey, employee journey, all of that needs to be catered to in a very elegant manner. And these are some visualizations. I'm going to actually show you some of the live demo behind this. So I'll pause here for a second. Maybe you can just look at this eye chart. But essentially, think of your mobile phone. Okay, you want to return to work. You want to log in quickly to your HR system or your local environment. Quickly select, I want to pass to go back to office. Have you taken a vaccination? Have you vaccinated before already somewhere else? Yes, then okay, you can give that proof, and move ahead. If no, then we'll help you with setting up a vaccination with a local provider or your own location or site, and how to set up that site, how to do that planning, capacity management, the query, all that comes through these interfaces that you see here. So I'm going to switch out of this for a second, but I want you to see quickly that this goes beyond the standard scenario of just vaccination to returning to work safely. And that means, every company out there has to think about June, July, August, when do they want employees to return back, and whether there's a vaccination process that they've already gone through, or we need to provide that. Okay, so this is kind of the summary of it. I can come back to this later. But essentially, I want to show you an experience which comes with this, and that's the live part of the demo. So there are two interfaces. One is obviously the bot interface. I think you can have it as a simple web page as well. Sometimes you can see this as a simple web page for pre-registration. This is one of the possibilities, and there's a form connected to this. So you can see two different experiences. One is for the consumer or for the employee or patient. The other one is for the administrator. And if I'm logging in as this administrator, I can check on my vaccine appointments. I can look at people who are in the queue. I can look at the vaccine inventory, which is going behind the scenes on this. Query the vaccine inventory. I can look at the outcome which is coming out of this and track and plan and follow up on those outcomes as well. And then have additional kind of forecasting techniques behind that that can be applied. For some reason, I'm having a little bit of a delay in my demo interface here. But if you see, there are different scenarios, whether you're a provider, a hospital, or whether you're a company which is trying to get all your frontline workers vaccinated, both the interfaces are handled over here. You can also prompt them to go find local vaccinations and where they can go and get that vaccination easily. That makes life easier for them, and they get educated about this whole thing. So I'm going to go back to the presentation and show you quickly a couple of those additional screens here, right, which I talked about. This is a visualization of the Vaccine Command Center. So I can even send updates to the government, to the state government, to the IIS systems out there. I can also look at, looking at their statuses in a life cycle manner. Where are they? Have they missed the first dose? Are they planning to come for the second dose? What do we need to do in that sequence to make sure everything goes smoothly? There's a little bit of thought about making this smart and efficient. And therefore, if I wanted to show you one example, an example of that would be putting a smart assistant and helping them send reminders to all of them, right? If anybody is missing an appointment or not there at that point, how do we ensure we send reminders out to all of them in one go, as opposed to doing a single click through? So I hope this gives you a quick idea of the experience. There are obviously many things to show you in terms of location planning, in terms of site management and queuing, and how things come together in the form of users administering them. We have also thought about the machine learning and AI capacity, in the AI capacity to take the data that we've learned on the past 3 months, 4 months, and then use that to predict the next steps and how things are moving along the way, and what can be done to change that. Should we restock more? Should we, go and try to get, more vaccines early on in the right section? Should we look at making sure the reminders are going on time? All this can be done in a very simple way, elegant way, using this kind of solution. So I'll leave it there, Ashu, and I'll send it back to you for further discussion.
Absolutely. Thank you, Viru. And folks, I know we went through a lot of information very, very quickly. Please feel free to reach out to us if you need more information. If you want to see it, we're more than happy to connect on that. Viru, if you can stop sharing, we can.
Sure, I'll do that.
Thank you. So yeah, I think I'm assuming the most important part of this is just getting to know what we were talking about, but now really asking Dr. Goldsmith and if you have any questions for us as well. So Bianca, I'm going to pass it on back to you.
Absolutely. So before we get into we do have a few more minutes until we dive into the Q&A. I did want to put another poll question out there for our audience, and that's going to pop up shortly in your screen. And the question is, what technologies help most in solving the vaccine management last mile delivery problem? If you could take a few seconds to answer that, and the results will show up in the chat box, so you'll be able to see what the other guests are selecting as well. Wonderful.
Excellent. Meanwhile, Ashu and Dr. Clifford, I got my screen back up here, so I can show you quickly. This is the artificial intelligence prediction, right? We were talking about restock, book more appointments, reschedule. There are a lot of people who are missing. How do we remind them and send reminders out back to them and say, okay, please come back and come to this center and continue that work.
So the restock is an interesting issue that you're describing there. If we talk about in the United States, and I realize we've got people from all over the world on, but the United States supply chain is a strange supply chain. It's a sort of a broken supply chain in some ways, in that there are two different parts. The federal government is where you're getting the restock from. You're placing the order, but it's really the states that have to then receive it and deliver it to the right locations. And I think we've talked a little bit about this, but it sort of shows in your system how important it is to have data right down to that county level, because that's where I think a lot of the problems are coming in at the moment, where an order is placed at the federal level. Let's say a state places an order with the federal government in the US for 100,000 vaccines for next week, 100,000 doses, and that could arrive anytime next week. The problem is the state then doesn't have all the data they need, and so they send it out to a big city area or even a rural area that they've assigned, and the numbers vary enormously. So and there's lots of reasons for this. Most likely, people are going out there registering to get vaccinations in multiple systems, and they're only going to show up for it in one system. So you register in your city, and that you've now sent the vaccines to the rural area. And so suddenly everybody talks about, this idea of getting your name on a list and being able to get a vaccination at the last minute at the end of a day when they know they've got a wastage problem ahead of them. And people are taking advantage of that. But if we could do it in a more granular way, and I think that's the kind of thing that your system does, allows people to make those granular decisions, I think we'll be far better off with a more accurate distribution system. So I just thinking about when you showed the restocking, I thought that.
Yeah. Excellent. Thank you.
Absolutely. Completely agree. Go ahead, Vidu.
No, I was just trying to say that, when people ask us, how do we use AI? It's through the data. We are data-driven, in that sense, data-driven, and we're trying to engineer that experience in a way that it really helps us think ahead, we plan ahead, and, be proactive in our approach. Of course, there'll be problems, and we have to face them. But if we have the data in our hand, then we can actually, deal with it a lot better.
Very true.
Wonderful. So I think that wraps up our discussion, unless you guys have any more questions between the three of you.
No, I think opening up questions would be great.
Wonderful. Great. So thank you, Dr. Goldsmith, Ashu, and Viru. We have learned a lot from our panel discussion today. We're now going to open up the floor for our live Q&A, where you can ask our panelists any questions you may have. If you haven't already, please type your questions into the chat box. Also, Dorothy, could you please turn off your video? Thank you. Okay, we're going to kick off with a question to Dr. Goldsmith. What are your thoughts around the trends hunting for leftovers, vaccines, and sites organizations around matchmaking patients with clinics? I know we touched on this a little bit, but maybe we can dive in.
It's actually a great question, because it's a segue from what I was just talking about.
Yeah.
I mean, it has sort of positive and negative elements. I don't know. I mean, I'll put out both sides. I'll put out the pros and the cons. The pros sort of fit with that senior question you asked me, which is, if somebody needs help, it's a great idea to have these vaccine hunters and people like that helping them. Because they are eligible, and they're part of if they are part of the CDC guidelines in terms of where they fit. Let's say they're over 65 and people now over 65 are being vaccinated. It would be great to be able to help those people where they don't have a family member to help. So that's something that really makes it easier. At the same time, that system is open to enormous abuse. And I've heard about them. I actually am incredibly frustrated by the abuse that I'm starting to see in the system, where people with means, with money, with access can use those, not necessarily hunters in the same sense, but certainly people who want to take advantage of that process and help them get vaccinated by monitoring the end of a day, for example. And that I'm hearing a lot about, especially in New York. I've been hearing that people monitor the ends of a day, looking for these excess numbers of wastage. And once you've got that first dose, you're locked in for the second dose. So you're getting put on a path, and that unfortunately is creating a degree of a big degree of inequity in the system that I would like to not see. But Ashu, what do you think? I mean, of that, the whole area.
Absolutely, and as you said, Dr. Goldsmith, I think there are two sides to it. One is certainly that's creating inequity, but at the same time, if that goes to waste, that's a problem as well. So I think and again, a lot of it goes back to planning or lack of planning, where there are smaller areas. I know CVS next to my house doesn't know when they're going to get it, and they get a distribution, and now they need to get rid of it. They don't have that much storage space. They don't know how to handle it. And so there is a lot of wastage that's coming into the system. And so some of the folks are taking advantage of that. So I think there is a both pro and a con right now of that particular situation. And it goes back to, again, lack of planning in my perspective, Dr. Goldsmith.
Ashu, I'll tell you of this interesting app I found out there. And this is in California, but it's fast spreading to all the other states now. It's written by a very creative, probably a developer, right, using Twitter feeds. So he's written a small little bot in Twitter. What it does is just scrapes all the appointment schedules that are out laid out by the government. So here in California, you have myturn.ca.gov. It goes and scrapes, and every hour, every minute, it's sending out notices saying, okay, in this region, in this area, so many appointments are going waste, or nobody's grabbing them. If you want, go to the Walmart, go to the Safeway, go to this location. Maybe you'll have a chance to get a last minute shot. So he's just written a small routine. It's just advising people that this is available. And I'm seeing a lot of people following him, and it's becoming so popular now that every county or every city wants this kind of feature. So if you go to Twitter and just follow @COVID, vaccine California CA, you'll see the types of notices I'm talking about. Very interesting.
Yeah. And I think that's really some of the things, Dr. Goldsmith, that we are trying to address with our vaccine management solution. As you said, we are trying to go granular. We are trying to provide more clarity to everybody who's using it, from a admin center to down to the distribution side. So completely agree. Bianca, over to you.
Yes, absolutely. Our next question comes in from, let's see, one of our guests, Mohammed. Yes, Dr. Goldsmith, Johnson & Johnson did run into some production lag. Has that been resolved?
So as of this morning, it sounds like it is that Johnson & Johnson certainly feel that they're on track to continue to provide that. We mentioned earlier that they've also partnered with Merck to make sure of that as well. I suspect that we are, from everything I can see this morning, that the lag is being dealt with at the moment. I do think, unfortunately, it probably we'll probably see a week or two into the next few weeks where there will still be a lag in supply from them. But I don't know if you have anything more to say.
Yeah, no, that's what we are seeing too.
Wonderful. Our next question comes in from Nick. Is there a map showing where each of the different vaccines have been distributed?
I saw Nick's question, and I would love to see that map. I haven't seen one, but if anyone on the call knows, please put it in the window. It would be a very useful map to see the distribution by vaccine type or by vendor type. Yeah.
I think my sense is, Dr. Goldsmith, I think they are knowingly trying not to share that, because there is already a bias a lot of people have against, for example, J&J, or I don't want Moderna and I want Pfizer. So I think knowingly they are trying not to put that out there is my sense at this point in time, because it should be easier to put it out there.
And I assume the question, maybe that's the answer. I assume the question is the US, is being asked about the US.
Right.
Even countries, you do that a little easier.
True. But even within US, so there was a big article, Dr. Goldsmith, where there was an entire community, underserved community, that was complaining about the fact that they're going to get J&J. They think that's an inferior one because they are underserved. They are getting inferior quality vaccine. So I think there will be more and more. So that's the reason I think they're trying not to talk about, but just deliver when you go on that.
Great. Our next question comes in from John. What preemptive strategy would be considered to address the next pandemic in terms of vaccine deployment?
I think that what we're seeing, the Biden administration, Harris administration has put out a very strong proposal for looking at supply chain overall in the US, but I actually think it's a worldwide phenomenon right now. And I think we need a unifying strategy for the next pandemic. I think there's going to be a lot of things we're going to have to unify for the next, as we look towards the next pandemic. One will be supply chain. The other is going to be diagnosis, or tracking and picking it up early enough. I participated in pandemic preparedness 10 years ago, I think, or 8 years ago. And really the emphasis was, how do we pick it up early enough that we can keep it isolated to a country or 3 countries with 2 border countries before it gets to this level. And obviously that didn't happen. Whatever work we had done at the Schofield Institute in Texas or other places didn't happen in this case. Maybe it's very hard to make that happen. I think early, I often think we need and Microsoft is working on something like this. I'm sure we're not the only ones, a tsunami type warning system that can let you know earlier. Now, it's easier where you've got a vector-borne virus like Zika or Ebola, where you can track the mosquitoes, and that's the strategy that that Microsoft's been using in a project called Project Premonition. It's being tested in Houston and in their border area, so that we can see whether more mosquitoes are picking up on a particular viral sort of strand in their DNA, but RNA, sorry. But I think we're going to need a global strategy, a supply chain strategy ahead of time.
Very interesting. That wraps up our live Q&A. Thank you very much for your questions and being interactive with us today on the polls. On behalf of Windwire and Microsoft, I wanted to extend my gratitude to the panelists for a wonderful and thought-provoking session on vaccine management. Today's event will be available on our website for an on-demand access by going to windwire.com. If you want to stay on top of the latest news, technology solutions, and events, please follow us on our LinkedIn, Twitter, and Facebook pages for up-to-date information. Thanks again. Thank you, everyone, for joining.